Hi, my name is McKenna Franklin, and the case I have decided to talk about today is a case in North Carolina that overturned a 90-year precedent that protected nurses from liability. This case is Conant versus Charlotte Mecklenburg Hospital Authority. In 2010, a 3-year-old was admitted to Carolina's Medical Center for a scheduled ablation. Her anesthesia team was made up of one Dr. James M. Doyle and Gus Van Sterbergen, a CRNA. The CRNA administered sevoflurane by mask, and shortly after, the patient went into cardiac arrest. After 13 minutes, Dr. Doyle was able to revive the 3-year-old patient, but sadly, this left the patient with permanent brain damage, cerebral palsy, and developmental delays. The mother of the patient decided to sue the hospital, the doctor, and the CRNA. The main aspects of this case involve malpractice and negligence. Malpractice occurs when a professional fails to use care and knowledge as another person in the profession would under similar situations that can lead to harm. Negligence is when the nurse does not apply the standards of care, which leads to harm in the patient. In our textbook, an example of malpractice would be a nurse giving digoxin without checking the patient's apical pulse or checking their digoxin levels. An example of negligence would be leaving the side rails down on a fall risk patient. After a 3-month trial, Dr. Doyle settled with the family, but the lawsuit against the CRNA and the hospital was retried in 2018. During this trial, the jury sided with the hospital and the CRNA because of previous precedent set in 1932 in the Byrd versus Marion General Hospital case. In the precedent set by the Byrd case, the ruling found that nurses could not be held liable if they were following doctor's orders or diagnoses, unless there was evidence of gross negligence. After the jury decided to rule in favor of the hospital and the CRNA, the patient's family filed an appeal that led them to the North Carolina Supreme Court. This led to the 3-2 ruling in favor of the family, which overruled the Byrd case. Justice Michael Morgan stated, in quotes, that due to the evolution of the medical profession's recognition of the increased specialization and independence of nurses in the treatment of patients over the course of the ensuing 90 years since this court's assurance of the Byrd opinion, we determine that it is timely and appropriate to overrule Byrd as it is applied to the facts of the case, end quote. This new ruling allows nurses to be held liable for negligent collaboration in treating patients, which is chosen by the doctors. The ruling of this case has led to a new trial. This case has shown me how serious mistakes are in this profession. This case also makes me question doctors' orders and my involvement in those orders if something were to happen to the patient. We are already seeing more violence in the workplace for nurses and also short staffing on units, which can lead to mistakes. With this new ruling, nurses will be criminally tried and not be tried on civil charges as it used to be. Nurses are starting to feel unprotected and anxious in the workplace now more than ever, and this will lead to more nurses leaving bedside. There's already a nursing shortage, and since this will lead to nurses leaving bedside, I can imagine that it will also lead to a lower amount of students wanting to go into nursing to avoid these types of legal implications that come along with the profession. Nurses and doctors are a crucial part of the interdisciplinary team, and if there's not trust and understanding between these two roles, then that can further lead to putting a patient at risk for negligence and malpractice. And nurses should not have to worry about lawsuits when we are simply following physicians' orders. That is our role as nurses, to complete tasks and complete the physician's orders to help care for the patient. And that's not to say that we aren't supposed to look at the physician's orders and, notice if something is drastically wrong, but it's also not in our scope to know the in-depth and the knowledge that doctors have to put those orders in place. So that's why I have to disagree with this ruling of this case, and nurses should not be liable for following a physician's order. Thank you.